Today we will discuss about the features of first trimester ultrasound. First, we will discuss about the barriers to the use of strict beta hCG thresholds in determination of pregnancy. There are 7 barriers. First, resolution of the ultrasound scanner. Second, that is patient body habitus. Third, position of the uterus. Fourth, type of hormonal assay. Fifth, experience of the sonographer. Sixth, masses such as fibroid. And 7, multiple discharge. Now we will talk about the diagnostic findings of early pregnancy failure. There are 2 diagnostic findings. First, there is CRL of 7 mm without a heartbeat. Second, MSD mean sac diameter of 25 mm without an embryonic pool. Now we will talk about the worrisome findings of early pregnancy failure. There are 8 worrisome findings. First, it is embryo with CRL less than 7 mm and no heartbeat. Embryo 2 to 6 mm without cardiac activity is a worrisome finding. Follow-up is needed to assess for cardiac activity in 1 week to ensure 100% specificity in diagnosis of miscarriage. Second, GSEC with MST 16 to 24 mm and no embryo. Embryo is typically seen by the time when the MSD is 16 mm. Follow-up is needed to ensure 100% specificity in diagnosis of miscarriage. Third, small mean sac diameter in relationship to CRL. Low fluid is associated with poor outcome. If MSD minus CRL is less than 5 mm, follow-up is recommended. Fourth, gestational sac appearance. Irregular shape of GSEC or the low position of GSEC and the weak decidual reaction are associated with miscarriage, but the size of the embryo and presence or absence of cardiac activity guides the diagnosis of miscarriage. Expanded amnion or empty amnion as evaluated by an experienced sonologist is diagnostic of miscarriage. If any uncertainty is present, then follow-up should be obtained. Sixth, that is yolk sac, it is more than 6 mm. These findings are associated with miscarriage, but the size of embryo and the presence or absence of cardiac activity guides the diagnosis, or it can be defined as calcified yolk sac. Seventh, embryonic bradycardia. Heart rate less than 100 may be seen in an 1 to 2 mm size embryo and it may be a normal finding, but in general, when the heart rate is less than 100, follow-up is recommended. Eighth, that is large subchorionic hemorrhage. It is associated with miscarriage, but the size of the embryo and the presence or absence of cardiac activity guides the diagnosis of miscarriage. Now we will discuss the risk factors of ectopic pregnancy. Any tubal abnormality that may prevent the passage of zygote or result in delayed transit. Second, that is previous tubal pregnancy. Third, history of tubal reconstructive surgery. Fourth, PID or IUCD. Increased maternal age, increased parity and previous cesarean section.